I am Dr. Adam, and with the Bright Minds at Beatrice, we'd like to take you on a healthcare and wellness adventure with these two delightful helpers, Fizz and Emmy, and a team of specialists, Dr. Saul, the knowledgeable Dr. Aisha, and the professor with unparalleled medical expertise, Dr. John. We'll help the ill family who always think they're ill deal with the many health problems that come their way and learn a thing or two ourselves as we go along. Now, shall we get down to important matters? Because your health matters. Hey, Dr. Adam. Oh, hey there, Phil. On your own today? How are we doing? Okay.
What in the blues is going on here? Come with me, honey. Dr. Adam's gonna fix this. Go sit with Phil, Sweet Pea.
Whatever you say, Bill.
Hi, Doc.
Well, at least she remains unaffected. Bill, Jill, how can I help the ills today?
There it is again. What's wrong with him? I've had just about enough of it. Doc, my whole family's gone weird.
Shut up, Bill. You're giving me a headache.
Weird in what sense, Bill?
I hate everything!
Oh, my poor munchkin. Where did I go wrong?
Hey there, Dr. Adam.
Here, Will. Take my seat.
Doc, I've practically been living with zombies. First it started with Phil, then we were like, no, it must just be the hormones, and he's almost a teen and it's a phase, but no, it's still going on. Then Jill got upset about that, and of course she stopped being all peppy, and Dad needs pep in his life or he spirals too. And I'm about to spiral too, what do I do, Doc?
That's interesting. Hey, buddy. So tell me, what have you been feeling? I don't know, Doc. I see. Do you mind if I take a crack at it then? Yeah, sure. Tell me if you feel any of this or not. Okay. Have you noticed any changes in your eating or sleeping patterns recently, Phil? I mean, I don't eat much, but I feel like I've recently lost my appetite or something.
And I make him all the favorites.
Oh, it's okay, honey bun. I still love your cooking.
I guess it's just exams and homework. But then I have to come home and be the star boy, and I just can't deal with everything. I just wish everyone would leave me alone.
Kid, you don't know what you're asking for. If only.
You gotta deal with these men. Oh, don't get me started on Jill. One minute she loves me, and the next... Love you, honey!
I'm afraid it's a bit more complicated than that, Bill. After the things I've heard and seen, I think you might be facing depression, Phil.
What?
And I think we should look into mental health as well as their signs and symptoms.
Wait. Mental illness? Doc, I know they're a little crazy sometimes, but come on.
Shall we go for a walk? Mental health is the emotional, psychological, and social well-being at every stage of our lives.
Okay.
Mental illness, on the other hand, is a group of disorders that affect our thinking and our moods.
Potatoes, Doc.
Actually, yes, because sometimes the distinction isn't obvious. For example, a fear of speaking in public can either be nervousness or a social phobia. It is important to make this distinction early on so necessary care can be taken.
Oh dear, what have we here?
Hello, Dr. John. Trying to help the ills deal with depression. Would you like to help us out?
It'll be my absolute pleasure, Dr. Adam. Depression is a very serious medical condition. It negatively affects how we think, how we feel, and most importantly, how we behave.
All that happens just because we're sad?
Which is nothing to take lightly, Bill.
We must know how to deal with it.
Well, that's all fine and dandy, Doc, but how do we get there? We need to first be in our senses enough to decide, right?
There are a few things you can do to bring yourself out of depression. For one, you can take solace in the good things that each one of you accomplish every day. That looks wonderfully appetizing. Magnificent, Jill.
Oh, why thank you, Dr. John.
Look! I got an
Well done, Phil.
A! Yay!
Hey, say, it's not a bad day for a walk, is it?
I like the positivity, Will.
Forgiveness is a big one. Everyone makes mistakes. Learn from what went wrong and don't dwell on the past.
Spend some time with your friends and surround yourself with positive, healthy people.
Have a flexible way of thinking. Explore new beliefs on how to live life where you can avoid stress as much as possible.
As Will was doing earlier, developing healthy habits not only improves your physical health, but also your mental well-being.
Last but not least, focusing on what's important contributes to emotional well-being.
Well then, I guess it must run in the family since clearly. Yeah, did you get it? No?
This is relatively true, Bill. Even though Phil is the one going through it, that doesn't stop the rest of the family from being affected by it.
It really does take a toll on the household, which explains why Will and Jill haven't been acting the same way.
Oh, come here, you guys. Oh, I'm so sorry.
Now that you all have a fair idea about your predicament, let me enlighten you with some statistics. Depression can affect any one of us at any time, and globally, more than 300 million people of all ages experience depression. An estimated 1 in 15 adults, 6.7%, are affected by depression per year. Additionally, 1 in 6 people, 16.6%, are estimated to suffer from depression at some point of time in their life. Women have shown to be more affected by depression compared to men.
I wonder why.
Depression in men is also a big problem and should not be overlooked.
This is all so confusing. Is depression an illness?
True. There's a lot of room for misconceptions when dealing with depression.
As I said before, depression is a serious illness. It can affect our functional capacity. Severe depression can make us inflict self-harm, even have suicidal tendencies.
Oh my god.
Oh, does it increase with aging? Because Phil didn't have it before.
Depression is not part of aging. However, as we age, we're more likely to go through loneliness, illnesses, financial troubles, and loss of family or friends, all of which contribute to older people feeling depressed.
Well, I certainly feel more depressed now.
Oh, Dad, we're all here for you, okay?
Yeah, Gramps.
With the exception of Phil, do children his age usually feel this way?
Unlike adults, children and teenagers may not express their feelings freely, so you've got to keep an eye out for any changes in their emotions or behaviors.
So everyone goes through the same thing, right? It's the same kind of symptoms.
Oh no, the symptoms vary with every individual suffering from depression. Some patients may not even feel they're in a low mood initially. Some might have difficulty sleeping, some may feel irritated, restless, helpless, and so on.
Almost sounds like whoever is depressed has to live with all those symptoms for the rest of their lives.
Actually, depression is treatable. According to a WHO report, 60 to 80% of individuals positively responded to a combination of medication and psychotherapy. In extreme cases, of course.
Don't you just get a crack out of people saying that only severely depressed patients should seek professional help?
Oh yeah. What many people don't know is that persistent depression can affect a person's functional capacity and lead to self-harm and suicidal tendencies.
You should definitely seek help from a family doctor in such circumstances.
Oh, and what about the speculation that says it's possible to fight depression with one's own willpower?
Well, Though there is self-help information available through social media, the internet, and even books, sometimes different people need solutions tailored to their needs. Seeking professional help could be more beneficial to combat depression.
Another myth would be that people with family history will get depression. I mean, people with family history of depression do have a higher chance of getting it, but it is not inevitable. So if you have symptoms that affect your day-to-day life, come see a doctor, like you just did.
Oh, you guys are gonna be fine. All thanks to me.
Dad!
Oh, Bill, give it a rest for one more day.
What? Wasn't I supposed to take credit for all the good things I did?
Well, he's got a point.
So there you have it.
Remember, it is all right to seek help if you feel the cloud of depression looming over you.
I'm sure the ill certainly will, Dr. John. Thanks for your help, sir.
A pleasure as always, Dr. Adam.
Now before you go, just a quick recap on everything we went through. Emotional, psychological, and social well-being contribute to mental health. Mental health should not be confused with mental illness, which is a serious group of disorders affecting mood and behavior. Depression is a medical condition that can affect anyone at any stage in life. Changes in mood, sleep, energy, appetite, concentration, and motivation are common signs of depression. Remember, health matters, including mental health. You can visit the below website to gain more information on health and wellness and access the Health Matters with Dr. Adams' series of videos. If you feel you need further healthcare and wellness information, you may consult with your family doctor.